the child could able to walk without any problem. Another interesting problem which can happen in the hip is a slipped epiphysis, where the ball slips over the neck of the hip. It can be, like, even though the incidence is very low, it may be because of the endocrine problem. The child won't know how to complain about this problem. Even though problem is in the hip, child will come with the complaints of pain in the thigh or the knee. So when the child is finding difficult to walk, always x-ray the hip to make sure the hip is all right. If you don't treat it in time, the child will have a lot of problem at a later stage. Again, the surgery is the only option. This is an example. I'm not going into. Then when you come to problem around the kneecap dislocation or subluxation is one of the common problem. About 10 to 20% of the children will have a patellar subluxation. It can subluxate and go back into its place, or it can dislocate and go back into place, or dislocate and stay in its place. The one funny thing about this thing is, even if the patella is dislocated and stayed dislocated, child will still be able to walk around but with altered gait. So, but frank dislocation on its own is seen only between 2 and 8% of the patients. Usually at an early stage, this can be treated with a knee brace or activity modification, but the child becomes symptomatic or the walking pattern is changing too much, surgery is the only option to put it back and repair the tissues around the joint. The next comes the knock knees. Knock knees are a genuvalgum, where the legs go apart. Usually it's not very severe, but if it becomes severe, it will start impairing their walking pattern and they'll find it difficult to walk. But if this can be picked up well in advance before the child matures, this can be treated by a simple operation, like by putting a clip on the inside. Gradually the leg will correct straight and the child can walk comfortably. But if you leave it later, once the child is matured, become an adult, then it's very difficult to treat it with a simple technique. Then we have to open it, cut the bone and straighten it. We can get it straight, but it involves a big surgery, and there are complications are more in these situations. The last one are the foot deformities. Foot deformities need some kind of a treatment, mostly conservative, because if you don't give a proper footwear, the child will have a difficulty in moving around. The common one, what we see, are bony deformity of the forefoot, like this one, or a flat feet. Flat feet happens because of the ligamentous laxity and the low muscle tone. If it's flat feet, this can be treated with the heel stretching exercises or wide shoes to keep the foot in its place. Suppose if the deformity, the forefoot deformity with the toes pointing inwards, then you have to organize a special shoes. If the deformity is too bad, then you have to correct it for the shoe to be fit for the child to move around. The last one, arthropathy of a Down syndrome, occurs in about 1% of the patients. It is almost similar to rheumatoid arthritis. It involves multiple joints, progressive, sometimes subluxation of the small joints can happen. Needs only medical management. If there is a suspicion of this thing, it's better to involve the rheumatologist at an early age. When we start the medication early, we may not be able to stop, at least we can slow the progress of the disease. The child will have a lot of anesthetic risk. Child will have a lot of healing issues. So before embarking on any surgical management, you have to be aware of all these things. So you have to think about preventing these things to go to that level. So in summary, about 20% of all patients with the Down syndrome experience orthopedic problems. Upper cervical spine instability has the most potential for morbidity and consequently requires close monitoring. Scoliosis, hip instability, patellar instability, and foot problems can cause disability if left untreated. In some of these conditions, early diagnosis can prevent severe disability. Since approximately 20% of persons with Down syndrome have associated orthopedic issues, orthopedic surgeons must be involved in the care of this individual to help provide a mobile and pain-free life. Thank you.
Thank you. Questions from the audience?
Yes, sir. Sir, here. Down here.
Hi.
Yes, sir. Yeah, hi. Sir, my daughter, she's 2. Yeah, she's 2. She started holding and walking, propping herself up on her own and everything. She's walking on her own, but she's 2 years. I mean, of course, being Down syndrome and blah, blah, blah. So, delayed is there. Because 2 years is a delay, I don't know. But they say there is a delay. So
No, in a child with the Down syndrome, walking at the age of 2 years is not considered delayed walking.
oh,
That is,
thanks.
for a child with the Down syndrome, 2 years walking is considered normal.
Okay, but she's walking with her hands.
She's doing extremely well. That's how you have to take it.
Then no worries.
So
Thanks.
Here, similar question. My child started walking when she was 2 years and 8 months, and ever since she started walking, the therapist recommended, the OT recommended that we give her the arc support. So she's on arc support as of now, and I see slight, signs of knocking knees.
Okay.
I can see from behind. So, but which the OT is saying that it will get rectified over a period of time. So, normally, how long will it take, with the arc support to get that corrected?
No, the thing is, any child, whether a child has a Down syndrome or a child doesn't have a Down syndrome, you cannot diagnose flat feet. No. So the thing is, because there is a lot of fat pad, all the children's feet will look like a flat feet. Okay, to diagnose a flat feet, you have to wait for 3 to 4 years. We don't give arch support. Arch support is only to prevent abnormal shoe wear. Arch support will not help to move the child from one place to the other. If the child has a flat feet, you have to make sure the child's heel cord is not tight. If the child's heel cord is not tight, you can give a heel cup to keep the heel in its right place, then the arch will develop. If you put the child to sit in a high chair, leaving the foot hanging free, you can see the arch nicely forming. If that happens, the child has a normal arch. The same child, if she puts a weight, then it becomes flat because the child's muscle tone is low. So you have to give a heel cup rather than giving an arch support.
More questions? Okay.
Thank you.
Thanks.
Thank you.
And I believe Dr. Shankar is our last speaker in this session. And thanks, Dr. Shankar, for providing a very pragmatic and technical issue of person with Down syndrome. And finally, I would like to thank the audience for being with us and for showing your patience to enjoy the lecture on different issues of Down syndrome. Thanks.
Thank you, Professor Hakim. I have a small request. Now we're breaking for tea, but please be back for the next lecture soon, because after that we are going to have the award ceremony. So request you all to please come back soon after your tea break. Thank you. 15 minutes, please. It's 4:15. By 4:30, it's 4:15. So by 4:30, please assemble here. Thank you.